Good afternoon. My name is Richard Rowe. I'm a behavioral health consultant with the UCLA Medical Center. Dr. Shaw referred you to me due to your complaint of insomnia. The doctor reported to me that you're having trouble sleeping, and he wanted me to collaborate with you to improve your sleep hygiene.
Yes, I have trouble sleeping at night, and I sometimes feel so tired. It actually affects my productivity, and I know my employer would not like to know that.
So, can you give me a thumbnail sketch of your evening activities that you do to attempt to get a good night's sleep?
Well, I heard that drinking at night helps you get to sleep. I started drinking actually before bedtime, so that's how I get to sleep.
So, you started to drink thinking this would help your insomnia, is that
Yes.
right?
Mm-hmm. Yes.
Can you tell me how that strategy has worked for you so far?
Well, not very well. I still get difficulty with sleep, with sleeping, and in fact, the sleeping problem is worse. It is sort of a vicious cycle.
So tell me more about the vicious cycle.
So the cycle is that I can't sleep, I drink, I still can't sleep, and then I drink some more.
So let me summarize. So alcohol is not helping you get a good night's sleep. In fact, your idea may be that your alcohol consumption has increased, and at the same time your insomnia remains the same or even worse.
Yes, correct.
So may I offer you some feedback regarding alcohol and sleep?
Yes.
Okay, first, alcohol consumption does not help with insomnia or improve your sleep pattern. It is true alcohol may help you fall asleep, but alcohol disturbs your middle and terminal stages of sleep. What I see here is alcohol may be as significant a problem as the problem of insomnia that you originally brought to me today.
Mm-hmm.
So, may I ask you some questions off of a short screening tool to assess your level of drinking?
Sure.
Let me ask you some specific preliminary questions.
Okay.
So what kind of alcohol do you drink?
I drink 2 drinks of scotch every night.
Okay. And can you define those 2 drinks? In other words, how you mix them or how you prepare them?
Okay, well, for each drink, I pour 2 shots of scotch over ice and sip it for about an hour until it's empty. Then I wait about half an hour and prepare another drink, and again, sip for an hour just before going to bed.
Okay, so it sounds like it sounds to me like you're drinking 2 drinks probably within a few hours of going to sleep. Is that correct?
Yes.
Okay. So let me specifically get into the screening tools with you now. That be okay?
Okay, that should be fine.
Okay. So the first question I have is, how often do you drink? How often do you drink something containing alcohol?
About 4 more times a week.
Okay. How many drinks containing alcohol do you have on a typical day when you are drinking?
Maybe like 1 or 2.
Okay. So let me just I just want to add one little thing here to this question, and that is, a drink is considered like 1.5 ounces of hard liquor.
Mm-hmm.
So when you're saying that you have 2 drinks a night and each drink contains 2 shots, then it really is more like 4 drinks. Would that be a fair assessment for your drinking habit now that your 2 drinks are pretty large and they almost equal 4 drinks?
Fair enough.
Okay. How often do you have 6 or more drinks on any one occasion?
Maybe about once a month, I would say.
So what happens during that one time a month?
Well, I mean, I go partying with friends,
Okay.
So
All right.
that happens.
Okay. So number 4 is, how often during the last year have you found that you were unable to stop drinking once you had started?
I think about the same, monthly also.
So sometimes at the party you have trouble controlling your drinking?
Yeah, I gotta admit, it's it's difficult to stop drinking when I'm in a social environment, drinking with my friends and whatnot.
Okay. So, and then, how often in the last year have you failed to do what was normally expected of you because of drinking?
I would say also once a month, monthly, yeah.
Okay, so then here's the next question. How often during the last year have you needed a final drink in the morning to get yourself going after a heavy drinking session?
I would say never, actually.
So you never had that happen at all?
No, not at all. No.
Okay. So number 7 is, how often during the last year have you had a feeling of guilt or remorse after drinking?
Monthly, one time, yeah, monthly, yeah.
So, okay. So and the next one is, how often during the last year have you been unable to remember what happened the night before because you were drinking?
I would also say once a month, from those parties, I think.
Okay, so sometimes those parties, you get carried away in those parties, huh?
Yeah, I do.
All right.
Yeah.
And then the next question is, have you or anyone else been injured as a result of drinking?
Well, yeah, I mean, at one of those, actually, in the last year, I have. I mean, one of those parties, I guess I kind of had a little accident, when I was in those social environments, and yeah, I have been injured. It has happened.
Okay. And then, has a relative or friend or a doctor of another healthcare worker been concerned about your drinking or suggested that you cut down?
Yes, I've actually had, like my girlfriend who notes that I'm drinking a little too much, especially on the weekends. So she definitely does think that I drink too much when I party, especially.
I see. Mm-hmm. Okay, so let me take a minute here. Okay, can I discuss some of the results of this test with you?
Yeah, that should be fine.
Yeah. I'm looking at the first three and the first three answers, like number 1, number 2, and number 3, where we talk about how much alcohol you drink.
Mm-hmm.
When you talk about how many drinks of alcohol do you have in a typical day, and how often have you had 6 or more drinks? Now, those 3 questions are about hazardous drinking use.
Okay.
Those are the answers to those questions. You and I should look at, because those kind of answers that you gave are indicative of some hazardous drinking.
Oh, I see.
Okay.
Okay.
So, and then the next set of questions, which is like 4, 5, and 6, where 4 talks about in the last year have you found yourself unable to stop drinking, and number 5, have you lost any productivity or anything like that because of drinking, or and then number 6 has to do with the last. Have you had any kind of desire to drink the first time in the morning after having a heavy drinking session? So those 3 questions have to do with dependency symptoms. And what I liked about one of your answers was number 6, because you answered 0 on that. You never had that problem at all. And it just so the other 2 indicate a moderate level of dependency, or at least a threat of dependency.
Okay.
So those are things that you might want to think about working on. And then number 7 through 10, like number 7 saying, have you felt guilty about drinking? Number 8 talking about having a clouded memory or forgetting to remember things after partying, we'll say.
Okay.
And then number 9 having to do with, has anyone been injured? You mentioned that you had been injured while drinking. Mm-hmm. And then number 10 talks about someone talked to you about cutting down.
Yes.
So those 4 questions have to do with hazardous alcohol use.
Okay.
Okay. After giving you the screening tool and getting your answers and scoring it appears to me that that there needs to be an outside provider involved in continuing treatment for substance use.
Okay.
So I'd like to make that recommendation to you. And here's the recommendation I'm making to you. I'm going to choose a referral source who has an excellent history of treating our patients here at UCLA. And secondly, this is a referral that has a history of collaborating well with me.
Okay.
So this is like an integrated approach to your healthcare. In other words, it's your healthcare and also the substance use issue.
All right. All right.
So what are your thoughts about this referral?
I'm in agreement with this. I would definitely take on that referral.
Okay.
I appreciate
so
that.
I believe you would benefit from attending the initial substance use appointments and follow-up appointments. I think there is value in having a health and substance use approach to your healthcare needs. What do you think of that thinking?
Well, yes. I mean, health is very important to me, and it really sounds like there's people close in my life that already thinks that I do have a drinking problem. So I would be in agreement with you there.
So just off the top of your head right now, what do you have to gain from engaging in a substance use treatment program?
Well, I mean, for one, I would definitely want to be more productive, and I don't want alcohol to affect my work. And of course, in the last year I had an injury too. I definitely don't want to go partying to the point where I get injured and wake up the next morning like that. So that's where I'm at, I think.
Okay, so what day and time is best for you?
I mean, of course, I do work a 40-hour work schedule. Maybe after 3 o'clock.
Something in
after
the late afternoon,
if
early
possible.
Evening?
Yes,
okay.
if possible.
So I'm looking at your insurance, and I can see that the substance use referral I want to use is covered by your insurance.
Okay.
And I believe your insurance will cover you for about 12 sessions.
Mm-hmm.
If you had to go a little longer in treatment beyond the 12 sessions, would you be okay for a short period of time doing a self-pay?
I think so, but I would definitely want to try it out first just to see how it feels.
And I also would work on giving you other referrals to use after those 12 sessions if needed.
Okay.
Are there any transportation issues for you?
No. I drove here, so I think that should be fine.
Okay. I'm going to use my... Excuse me for a second. Let me get over here and get my phone. I'm going to call the substance abuse people right now and make an appointment for you. So you said any day of the week after 3 o'clock is okay?
Yes.
Okay. Good afternoon. Could I speak to John Smith, please? John, this is Richard Rowe from UCLA Medical Center. I have a patient that I want to refer to you for some substance use counseling. Okay. He has Blue Cross Blue Shield insurance. Okay. So do you have any time available anytime during the week? Maybe after 3 o'clock or 3:30 in the afternoon. So, how about tomorrow?
Okay. Yeah.
Tomorrow's fine at 3 o'clock. We're going to set that up. All right. Okay. Thank you, John. Bye. So he's fine with that appointment, and let me know how the appointment goes. And you and I will get back together in a month. Now, here's the other thing, is that once we get the alcohol a little under control, we'll see what that does for the insomnia. It's still an issue with insomnia. we will start working on a program for that issue.
Okay.
Okay?
Great.
So you need to go out to my receptionist, and you need to make an appointment to see me in another month.